Welcome to the Denials and Appeals Management Certification. This is the overview of the revenue cycle, Session 1. The speaker has no conflict of interest. The objectives for today's session are to explain the revenue cycle, define the components of the revenue cycle, and identify how the revenue cycle breaks down. Revenue cycle definition. The Healthcare Financial Management Association defines the revenue cycle as all administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue. In other words, it's a term that includes the entire life of a patient account from creation to zero balance. The revenue cycle actually begins when the patient presents for service to any facility, through until the time where the patient's final bill has been adjudicated or achieves zero balance. The revenue cycle processes flow into and affect one another from start to finish. So when those processes are executed correctly, the cycle performs predictably. Problems early in the cycle can have significant ripple effects, and the further an arrow travels through the revenue cycle, the more costly revenue recovery becomes. The revenue cycle includes you. Every person involved in any aspect of healthcare affects the revenue cycle. Therefore, a complete understanding of the inner workings is the first step in effective denials and appeals management. There are several goals of the revenue cycle process. Some of them include increased cash flow by improving point-of-service collections, increased number of inpatient days recertified, streamlining of workflow design and increased automation, reduced denial rates, increased appeal and recovery rates, and definitely to ensure compliance with regulatory requirements. Here is an example of all the pieces involved in the revenue cycle process. Let's start at the beginning with patient access. A patient's experience with the revenue cycle actually can begin prior to them presenting for services in any healthcare facility. This can happen in terms of prior authorization or pre-certification necessary for services required. The patient access team will schedule a patient's service, and then they can register for those services once they arrive at the hospital or healthcare facility where those services are to be performed. Depending on the procedure and the patient's financial situation, financial counseling can be required and can be attained at this time. Once those pieces are in order, the patient will present or proceed for their encounter to be provided. All the charges associated with the encounter being provided will be captured, and coding will be able to pick up those services so that it can be billed for appropriate reimbursement. Throughout this entire process, the medical record documentation will need to support the services provided as well as medical necessity. The appropriate documentation can be reviewed with the utilization review team, ensuring that all the pieces and parts necessary are available prior to billing for the service to be considered medically necessary. Once those items have been executed, the claim will be submitted. Third-party follow-up happens when there's any problems associated with the claim being submitted, and if there's any rejections because of denials or inappropriate documentation, the rejection processing piece will allow for cleanup of that particular process. Once that's completed and payment is received, it can be posted. Any appeals necessary because of disparity between the reimbursement expected and what's actually received can be handled in the contract management area. Once all these parts have been taken care of and the bill is at zero, then we start the process all over again and begin at the patient access area once more. Each point in the revenue cycle marks a moment of truth. Let's start at the beginning with scheduling and pre-registration. Once a patient's insurance is verified and any point of service collections have been executed, the medical record or encounter form can be created, marking the beginning of the revenue cycle. Utilization management comes into play here, ensuring that all medical record documentation is available and appropriate to support medical necessity. Once the patient care has been rendered and all the services have been documented in the medical record, a concurrent review can be performed. This review can support all appropriate charge capture from the charge master, and the encounter can then be coded based on the medical record documentation. Once this occurs, the chart can be submitted for billing. If there's any unbilled file management that needs to occur, or identification of late charges or other gaps in the medical record documentation supporting appropriate coding and billing, this can be identified at this level. Prior to the billing process, once the billing process occurs, any follow-up can be performed. Here's where denials and appeals management comes into play. Once the bill has been submitted, if there are gaps that did not get caught prior to the bill being processed, then the denials and appeals management team can use the electronic remittance advice to identify where the problems occur. Cash and adjustment processes occur at this level as well, and there's a reimbursement review to identify what's expected versus what actually was captured. Bad debt management then comes into play here, as it's important to make sure to identify why those gaps occur and then bridge those gaps going forward for a smooth revenue cycle process. If you think about the revenue cycle from a front, middle, and back-end perspective, you can get a much better feel for where some of the more major concerns and opportunities for improvement lie. Let's start at the front, for example. A patient encounter again begins pretty much at the point of registration. It is important, even at this level, to make sure that all the pieces and parts of the medical record information are appropriate so that the Health Information Management, or HIM coding professionals, can collect the information necessary to code and submit for appropriate billing. Once the services are rendered, here's an opportunity for continuous quality improvement, or CQI professionals, to come in and audit the information to ensure that the services provided were in fact appropriate and identify any opportunities for quality improvement with the physical exam. After the patient has received services, then charge entry occurs. Here's where patient accounting starts to come into play. Once the charge entry has been executed and we've taken all the documentation from the encounter to use in support of appropriate charge entry, we can submit the bill for services. Earlier we talked about the importance of all the pieces within the revenue cycle functioning appropriately to ensure a smooth revenue cycle outcome. Take for instance this slide. This slide suggests the importance of making sure the processes on the front end are executed appropriately in order for all the various components associated with the front end to flow smoothly. For example, notice the patient scheduling and registration here, and the insurance verification authorization. Making sure that those pieces are in place will help prevent claim scrubbing and editing on the back end and ensure clean claim submission the first time. If the demographic information, insurance verification, or other front-end processes aren't executed appropriately, then what happens is the back-end processes like claim submission and claim scrubbing and editing are impacted, causing a ripple effect in the revenue cycle. So there's several components that are impacted and affected by an absolutely clean front-end process. Let's talk a little bit more about the front-end process. Most organizations employ professionals like financial counselors or insurance verification and eligibility specialists to help ensure that the appropriate patient demographic documentation is collected prior to a service being rendered to ensure decreased denials. This information is necessary to continue a smooth revenue cycle process so that continued denials can be avoided. The front-end or back-end staff can clarify information and validate concurrent issues to determine the types of denials that an organization is receiving and provide that information to the appropriate staff so that the collection of the patient demographic data can be executed effectively at the beginning of the revenue cycle. Some of the strategies used on the front end to support an effective revenue cycle include compliant registration, proactive insurance verification, and a thorough patient eligibility process. Errors in spelling, incomplete verification and confirmation of eligibility, or determining patients' deductible and copays ahead of time are all pieces of this process that prevent denials on the back end and ensure a smooth and successful revenue cycle experience for each patient. Let's talk a little bit about the middle. When we talk about revenue cycle protection in the middle, we're really talking about care facilitation, medical necessity, and discharge planning. All of these factors go into revenue protection. One of the largest, most important functions in the middle of the revenue cycle could easily be identified as case management, making sure that all patient admissions are appropriate and the documentation necessary to support authorizations and combat concurrent denials and appeals is necessary for an effective revenue cycle process. Making sure that all the pieces and parts in terms of medical documentation are available is imperative to effective case management as well as utilization review. Here are some other pieces of the middle when you start to think about revenue protection that we should discuss. The middle processes in general will be any clinical function, any patient care related situation, medical necessity reviews, any authorization to support continued stay, and ensuring complete and accurate clinical documentation is captured. Now when you think about the case management and the utilization management function, this group is going to ensure that all concurrent medical necessity reviews are completed for all payers, any admission and concurrent authorizations are executed, whatever medical necessity is needed to ensure continued stay is available and captured in the medical record documentation, and they also facilitate the timely discharge of all patients. The clinical documentation specialist, on the other hand, is going to ensure and help the case management and utilization management team ensure that complete, concise, compliant physician documentation is available for support of all medical necessity reviews. This can be done with concurrent and/or retro queries. The documentation then would focus on the details necessary to capture the acuity and support accurate reimbursement and make sure that all treatment provided equals the revenue reimbursement. Case management plays a huge role in any denials associated with the middle of the revenue cycle process. Case management is there to ensure all level of cares are appropriate, for example, inpatient versus outpatient admissions, and to make sure that all documentation to support the appropriateness of medical necessity for continued stay are available in the medical record prior to discharge. Case completion and discharge notification are also imperative to the success of any revenue cycle here, making sure that information is available to support any clinical review of denials, facilitate peer-to-peer review, and then in the event that there's a need to create a written letter of appeal, case management is there to help ensure the documentation is available and complete in order to support an effective appeal process. Moving on to the back end then, one of the goals of the entire revenue cycle process is to be able to support a clean claim submission the first time. So the back end starts at that point where we are ready to submit a claim to a payer. So we've appropriately registered a patient, we've provided excellent care, we've documented that care, we've captured all charges necessary, we've made sure that all medical record documentation is complete and thorough. We've provided the codes necessary to submit to the billing or to submit for billing purposes to the insurance company, and now the revenue cycle back end comes into play here. The goal again is to be able to submit a clean claim to the payer. If there's not a clean claim, then we have to determine, is it a back-end error or is it a front-end error? If it's a front-end error, we have to go all the way back to the front end of the revenue cycle process, maybe beginning at patient access, to determine where the disconnect occurred. If it's a back-end error, there are things that you can identify and ways to mitigate those errors prior to the submission of the bill, again ensuring an effective revenue cycle process. Once those issues are identified and the claim has been corrected, we can then submit the bill for reimbursement. We also want to make sure that we identify where the error occurred so we can either A, be sure to work those problems on the back end and try to streamline those issues going forward, or B, make sure that we can send that information to the front end to prevent a denial or prevent problems with the effective flow of the revenue cycle going forward. Let's look at some of the components that help to ensure we have a smooth back-end process with the revenue cycle. From a front-end perspective, making sure that the denials and appeals management is executed effectively will help to ensure that the billers, collectors, and follow-up staff have what they need to support an effective and appropriate bill going out the door. Health information management auditors and analysts can make sure that the documentation provided in the medical record is supportive of appropriate codes submitted for billing purposes. Other pieces of the back-end process involve coders, accounts receivable, and financial counselors. The coders, of course, ensure the accuracy of the medical records so that the billers can submit a clean claim. In the event this does not occur, audit staff is available to identify the reason behind the problems associated with the submission of the bills. Accounts receivable then comes in to help ensure financial responsibility by reviewing the payments, the structure of those payments, and any posting errors that may occur. Collectors then can come into play to recoup unpaid services, copays, and deductibles, and self-pay issues. The financial counselors help to ensure financial integrity because they support patient advocacy. They help to give the patients the information they need on the front end to help avoid increased bad debt collection needs on the back end. Some common pitfalls seen on the back end include inaccurate ICD or CPT code assignment, incomplete physician or medical record documentation, duplicate line items, or incomplete claim submissions. All of these can be mitigated with accurate capture of treatments and services, accurate capture of charges and concise charge master entry, prevention of duplicate claims, and making sure that all line items on a claim are completed prior to submission for billing. It also helps for all staff to have an intricate knowledge of LCDs, or local carrier determinations, and NCDs, or national carrier determinations, to make sure they're aware of indications for coverage, limitations of coverage, and the documentation requirements necessary to support medical necessity. Proper use of modifiers and proactive education to clinicians will allow for compliant physician orders and compliant documentation in the office and hospital settings. Many of the requirements necessary to submit a clean claim have been created by the National Uniform Billing Committee, or NUBC. This committee was created by the American Hospital Association in 1975 in hopes of developing a single billing form and standard data set that could be used nationwide by institutional providers and payers for handling health claims. I will talk about the 5 processes, the 5 steps in the process to bill Medicare effectively. First, we have to decide that a service is medically necessary for this patient. Second, we provide the best service to meet but not exceed the patient's needs. Next, we document the service provided in the medical record. We then select the most appropriate CPT or HCPCS code for the service, and then, utilizing the requirements provided by the National Uniform Billing Committee, we submit our bill to Medicare. Claim formation begins at the time the patient's insurance is verified and we receive authorization for a service to be provided. Once that occurs, the patient can receive the service, and then the claim can be submitted for payment to a third-party payer. Once the third-party payer receives the claim, they will either pay the claim or deny the claim and provide that information and feedback to the entity, at which point a payment will be posted or the denials and appeals management process will begin. Clean claim submission suggests that an entity was able to provide information for a third-party payer without having to encounter any issues associated with denials or inaccurate entries. All entries for the submission of a clean claim must be accurate for the fields of information contained in the UB04 or the CMS 1500 billing forms. One element of a clean claim submission for inpatient encounters is present on admission. POA is a Center for Medicaid and Medicare Services initiative that was instituted to identify whether or not a patient's condition was present at the time they were admitted to an inpatient facility. If it's determined that a patient's condition was present at the time the patient was admitted, or a designation of Y for yes, then CMS will pay for the complicating condition, CC, or major complicating condition, MCC, associated with that encounter. If it's determined that a patient's condition was not present on admission and was something that was realized following the admission to an acute facility, CMS will not pay for any CC or MCC associated with that encounter. Present on admission can also be unknown, or have a designation of U, or a designation of W for clinically undetermined. There are also situations where conditions are considered exempt from present on admission status and generally surround around newborn encounters. There are several items that can prevent clean claim submission. Some of them are listed here. It could be something as simple as an incorrect spelling of a name. It could be that the claim information is not complete. There could be a frequency limitation on the service provided. Or it could be that a provider does not participate in a particular insurance, or the service that they provided is not a covered benefit. There are several things that can prevent the submission of a clean claim. Speaking of claims, let's talk a little bit about status indicators. A status indicator is assigned to HCPCS and CPT codes to indicate how the service is processed and or paid under the Outpatient Prospective Payment System, or OPPS. There are several status indicators. Here are some of the more common indicators you may be exposed to. If a CPT or HCPCS code has a status indicator of B, it means it's not paid under the Outpatient Prospective Payment System. That may mean that there may be an alternate code, or it may be paid by intermediaries when submitted on a different bill type. If a CPT or HCPCS code has a status indicator of D, it means that that particular code is discontinued, and it will not be paid under any OPPS or any other Medicare payment system. Here are several other status indicators that you may see or have exposure to. Some of the more common ones that you may be familiar with are X for ancillary services, or S, significant procedure not subject to multiple procedure discount, or T, significant procedure subject to multiple procedure discounting. Timely filing is imperative for a smooth revenue cycle process. The definition of timely filing is when the final date on the claim received is considered for payment by Medicare or third-party payers. Medicare filing periods vary depending upon program billed, and the time frames may change according to some payer contracts. Timely filing deadlines are generally getting shorter, although the medical billing process is getting more complicated and more detailed. With the heightened concern over fraud and abuse, claims must be scrutinized more closely prior to submission to avoid having to deal with timely filing issues. If not, the result is a poor combination for any medical billing department when trying to meet an arbitrary deadline imposed by the carrier providers must take an aggressive appeal position on such claims that are denied for timely filing issues. Let's look at a few timely filing policies for third-party payers in Medicare and compare the two. Cigna Healthcare's timely filing policy suggests that any participating provider claim submitted 6 months or 180 days after the date of service, or any non-participating provider or member claim submitted 1 year or 365 days after the date of service will be considered for payment. Medicare, on the other hand, will accept claim submission up to 1 calendar year following the date of service. So you can see a little bit of the differences depending on the payer. In the end, best practice is to avoid timely filing denials at all costs. In the event that an organization does have to encounter timely filing issues, then providers should aggressively take an appeal position on these claims and fight for the reimbursement of the services that were provided. So let's review what we've learned and talk about some of the most common areas of breakdown within the revenue cycle. We'll start back at the beginning with the patient registration access. Any inaccurate patient information collection, data entry, or failure to verify third-party payer insurance can start the process of the revenue cycle off wrong, leading to a ripple effect throughout the revenue cycle, supporting a broken experience for the patient and the entity. There could be service line breakdowns associated with inappropriate charge capture collection, inaccurate or incorrect use of CPT and HCPCS modifiers, or potentially wrong procedure codes being billed. At the health information management and coding level, if we have inexperienced coders that are not processing the medical record documentation appropriately and assigning inaccurate ICD-9 or 10 code assignments, it leads to inaccurate MSDRG assignment, leading to inaccurate or inappropriate reimbursement. If there's no operative report or discharge summary, it's difficult to make sure to capture the entire encounter appropriately, leading again to incorrect CPT code assignment or ICD code assignment, supporting a mismatch between hospital and physician code assignment, which delays the bills. There could also be potential medical necessity issues, all leading to incorrect code assignment. From a patient accounting and billing perspective, if there's any problems with the interface between coding and billing, for example, a code drops off of a claim or a modifier drops off, or there's any revenue codes missing on the bill prior to submission, all of these issues can prevent a clean claim submission, leading to denials and inappropriate reimbursement. If there's any removing of line items to get paid, or inexperienced or inefficient billers leading to inaccurate and misapplied cash, all of these elements can lead to disruption in the revenue cycle. In order to ensure revenue cycle health and denial avoidance, 4 critical steps have to be capitalized upon. Assess your current status. Identify where there's gaps and figure out how to mitigate those gaps to prevent future denials. From that assessment, you can identify future state recommendation and goals, and then implement key performance improvements in order to make sure to support a positive revenue cycle experience going forward. Using report analysis and measurement to continually feed that information back to leadership helps with continued assessment and supports continual ongoing maintenance of your revenue cycle. Utilizing this methodology, all the core processes are examined to ensure an organization is operating at maximum potential. The key to success centers around the right information when registering the patient, concise, complete, and accurate documentation in the medical record, the capturing of all costs, accurately assigning principal and other pertinent secondary diagnosis, in addition to correctly coding procedures in the medical records, allowing for appropriate and timely claims processing. When all these elements are executed effectively, we have revenue cycle success. Remember, time is money. Getting it right from the beginning leads to optimization of financial reimbursement in the end. In the event that denials and appeals are necessary, it is important to understand the reimbursement mechanisms from individual contracted payers in order to optimize efficient reimbursement and correspondingly reduce account receivable denials. Thank you. This concludes Session 1. The following reference sites were used in the creation of this presentation.